So my assessment of you with your situation is good news and bad news, okay? Most people want the bad news first, right? So the bad news is, from an ethical standpoint, I would tell you that you're not really a great candidate today for a hair transplant. It's not really that bad of news. It's actually kind of good news because you're not bald. The issue with you is, with a lot of the patients that contact us, is that you have what's called a diffuse thinning. Okay, so the only way, the only ethical way to manage diffuse thinning is not to do a transplant, but it's to get you to somehow thicken and/or try to grow back that hair. Unfortunately, the other bad news is the best way to do that you're not a big fan of, and that's that medicine. Now, before you shut me down in a nice way, let me just go through with you what I do with everyone. I've been doing this 37 years, okay? I lost my hair at 18, and it's been a long time. The medicine that we have here available to us here actually in Austin has a combination of a very high-grade finasteride and a minoxidil Rogaine that is in the pill, so you don't have to worry about rubbing it on your head. The actual side effects from the case study, side effect details is less than 1% in your age category will experience either a little bit less sex drive or a little bit less ejaculative fluid, not less sperm. In that 1%, if patients just stayed on the medication for about 6 or 7 weeks, they just were sensitive to it when they started. They usually 65% of the time that will work itself through, and your body will just get used to the medication. And like myself, for 19 years on this stuff, I don't even know I take it. So what the advantage would be to you if you were willing to try it, I'm not asking you to make that decision right now. We have a real nice, maintenance kind of medical team follow-up plan here. We don't leave you just flapping in the wind. They bring you in for photos. They get a set of photos now. They get a set of photos in 4 to 6 months. You're on the medication. If you don't like the medication, you get off the medication. We get back to square one. We start over. We talk about some other things. But you would be shocked. You would be shocked on the type of results we're getting with guys like you that literally, in that diffuse area, you've got a lot of miniaturization going on, meaning your hair is kind of falling, not right away, but it will continue to fall. And that's why a transplant's not a good idea right now. The medicine will strengthen that hair, and it'll look like all that hair is growing back. So if you give that 6 months, it takes a full year to get the final results. You may be perfectly pleased after 1 year with just the medicine alone. You may say, you know what, you guys saved me $10, $12, $15,000 for a hair transplant, and my hair looks twice as good as it did. I'm cool. I'm happy. You guys are awesome. I could probably, for fun, you and I could Google in the state of Texas hair transplants, and 7 out of 10 clinics would want to do a surgery on you. They're not doing anything wrong. They're just in business to make money, and they want to do surgery. As long as your donor hair, the hair in the back, is good solid hair and you have enough loss, technically you're a candidate, because as long as that donor hair in the back is strong enough, it will grow. But you're going to risk shocking some of the hair up top, and you're going to keep losing that hair up top. So if my fingers represent the hair on your head right now, and we put hair transplants in, you're going to be happy. But if you lose your existing hair, you're going to be back to where you started, and your before and after photos are going to show that there's no improvement or very little, maybe on the hairline a little bit. So what we like to do here, and with the better doctors, we're not the only good guys, what the better doctors do is they set you up on some sort of a preventative plan first, and just take our time. Strengthen the existing hair, stop the ongoing loss of the existing hair, and then if we need to go in there and do a little work with transplants, then it's all net gain, which is really what we're after. Then it's a really good return on investment. And I tell this to 85% of the people I speak to every day. I'm doing this 12, 13, 15 times a day. 85% are getting this exact spiel. That's the way we do it, because we're choosing our patients. We're picking and choosing the best patients so they get the best return on their investment. And you're getting honest, true opinion anyway. So what I would tell you is that the best anecdotal evidence we have to share with you is based on our meetings every year that we have in various cities around the world, where all the board certified doctors get together for a week. And out of that week, 1/2 a day is completely dedicated to nothing but finasteride side effects. What we learned in that meeting also is that in the industry of these doctors that are highly regarded in hair and board certified, we decided that based on his assessment, we were not going to prescribe this medication to men, mostly of younger ages, that had been on significant antidepressive and anti-anxiety medications. We felt that something, and I'm not a doctor, so I can't tell you specifically how the brain is wired, but something was not going to work, or potentially not work, if these young men were on medication since they were 12, 14, 16 years old. So that subset we took out. The information online that does a pretty good job of scaring people with the, side effects that don't go away, post finasteride syndrome and whatnot. We have not gotten to the point in the industry to where we feel uncomfortable prescribing this medication. Where we're just not seeing that. I mean, the majority of erectile dysfunction in men is 30% is due to testosterone issues, not DHT issues. So, you know what I mean? So I understand the fear that you could take something and it could be permanent. I mean, I have a lot of experience as a passionate guy who lost his hair at 18. I'm really not interested personally in passionately talking about thickening your hair. At the same time, you have a percentage chance that you may never be able to have sex again. That's not for me. I mean, I don't want to communicate that to you, okay? So about the most intense I've seen in this industry are doctors. I know there's a couple in Miami that I have a lot of respect for that actually send out a PDF or a disclosure about everything that's anecdotal that's on the internet, just to make the patient more aware that this is what's being said. But we're not seeing it in this industry. So in this industry, there's 265 full-time hair doctors in the world that are board certified by the ABHRS, the American Board of Hair Restoration Surgeons. This medicine is the -- 1 tool that we use to help our patients stop losing their hair. Okay? In these clinics of 265 board certified doctors, 19 years and millions of prescriptions, we're not seeing these side effects that the internet talks about post finasteride syndrome. We're not seeing it. So I know that doesn't give you a solid answer of is this happening or is it not, but we talk about it in this industry, like who's writing these prescriptions, because we don't see it. And think about it this way: if it got to the point where this was actually true, and these doctors and a lot of these guys, like the one here, Dr. McGrath, who's really, in my opinion, a stand-up guy, he's an honest guy. It's no longer about the money. He's been doing this 20 years, just trying to help people. Last thing we want to do is hurt people. If we took that medicine off of our charts, meaning we sent out an email and told the patients that we're no longer confident in prescribing this medication based on side effects that are being documented online, if we did that, our business would go up 40% a year for 5 years. So it's kind of a bittersweet conversation where, every single young man that I speak to, including yourself, I take a lot of responsibility for. I'm not a doctor, and I'm pretty passionate, and I'm supposed to give you the information that I'm learning from these doctors. If I get one little inkling that this very, very mild 1 milligram of finasteride is going to hurt you, I'm done. I'm not talking about it anymore. I'm going to give you all the reasons why you shouldn't do a transplant, because you have a lot of hair and it could shock out and continue to lose it. But guess what? I'm doing pretty good, and at 19 years old I had my first procedure. There was no medicine, and I'm not bald, and I'm pretty happy about that. So there's two sides to look at it. What I try to do, what we try to do, is save you from doing multiple procedures over and over and over and over, save you a lot of money, and get your hair back to where it can be so you can be a better candidate for the procedure. So I don't know if I'm answering your question. You know, obviously I can't answer it directly in regards to what we feel confidently, that there's absolutely zero of those post-finasteride things, even though we don't see them in the industry. But you know, we're also looking at the internet, which drives a lot of clicks and gets a lot of views, and negative information usually does better. So it's frustrating to the industry, but we're just trying to be honest. There's also a topical. So it's non-systemic. So if you wanted to try a topical, I would be more comfortable with you just doing that for 6 months rather than jumping into any procedure. Yeah, I agree. I mean, you have to be comfortable, and you know, you have to be confident, and you have to trust someone. You know, so you know, my non-medical opinion for everyone that I've dealt with in all these years, as this medicine has gone beyond expectations. Any of the issues I've ever dealt with any patients ever has always been self-admittingly placebo. I mean, I've had guys that go on the medicine, literally go on the medicine, grow a ton of hair back, save all their hair, get a transplant, look like a movie star, look awesome. Come back in 5 years and start to get a bald spot in the back, and the first thing I say is, you went off the medicine. Well, you know, I was dating this girl and I had a problem one night. Okay, that's it. I mean, you know, I don't want to get into the minutia, but men are expected to perform at a high level in the bedroom, and God forbid they have a bad night. Oh my God, it must be the Propecia. You know what I mean? So you know, I don't want to give you bad news, but you know, I would be very cautious with jumping into a procedure if you're not willing to just try the medicine. Dr. McGrath, and why I actually have a job is because he's in surgery, and he does great surgery. So my job is to basically tell you everything he would tell you. And he would say, look, we've never seen that post-finasteride stuff going on, at least in this clinic and any of my colleagues, anywhere. Try the medicine. If you don't like the medicine, you go off the medicine. But if you're, and I used to be afraid to fly when I was young. I was afraid to fly. My friends were like, "Are you gonna stay in New Jersey your whole life?" I'm like, I guess so. Now you don't fly around, but it was a challenge because there were plane crashes. So there were plane crashes. So could there be people out there that have this syndrome or whatever it's called? Absolutely, there could be. And I don't want to be responsible for putting you at risk with that. That you're a grown man, you make your own decision. But I would caution you to do procedure unless you consider some form of preventative. You're also welcome to come in and meet the doctor. I mean, you know, I'm not saying you're complicated, because you're not. It's just that it's good and bad, right? You've got hair, you're not bald. So you're losing your hair. That's not the kind of patient we want to do surgery on. So maybe the doctor would have some ideas as well. Maybe you'd feel a little more confident about the medicine speaking with him. You're always welcome to come in. You know, the virus is winding down, hopefully. I've been doing this well before the virus anyway, but my job is just to give you the facts that we use here, give you information. And then, you know, you speak to the doctor, because he's going to accept responsibility for your medicine anyway, or your transplant, and you've got this information I've given you to bring to the table and speak to him about if you like. It's $120 for a 3-month supply, shipped to you out of South Austin with no shipping fee. The clinic will charge you a one-time fee to manage you, to manage your chart, to manage your photos, and bring you back every 4 months. They'll charge you a one-time fee of $300, not a yearly fee. That $300 would go toward your procedure if and when you decided to do one.
Sure.
And that's how we do it. And like I said, you know, I've got probably on a low end 8 people a day I send over there. On a high end, as many as 13 or 14 a day that I'm getting on this medication. We have a conversation 6 months down the road, 8 months down the road. The hair's changed tremendously. And then we can really talk turkey about a transplant. On the website at McGrath Medical, if you go to the before and after section, you'll see medical therapies. You'll see a lot of examples of guys exactly like you having this conversation with me. I mean, not videos, but they're before and after photos. And we just wanted to throw some examples out there. There's other things you could also try, which is pricey. You know, there's things that you can do where the clinics are going to make money. You can do injectables. The injectables, they work. To what level do they work? Results are going to vary. You could do a Capillus laser cap. Capillus laser cap is $3,500. They work, but to what level? Neither of these things or anything else that any of the clinics are going to have besides the finasteride are going to inhibit that DHT. So, you know, that's why I'm such a big fan of it, because the DHT is what is attacking your hair. So all I tell you is the first thing you need to do is really make a definitive decision about that medicine. And then if you don't want to use it, I'm not offended. I don't have a problem with that at all. Then we can talk about other things. But I think that that's the most ethical way to talk about, you know, you.